My name is Sabine Mueller. I'm a pediatric neuro-oncology at the University Children's Hospital in Zurich, Switzerland. I also have a faculty appointment at the University of San Francisco, California. My specialty is taking care of children with brain tumors, and I was asked by the Brain Tumor Charity to comment on some of the most frequently asked questions from families who have a child who has a brain tumor. Understandably, the current pandemic with the new coronavirus leading to the disease that is referred to as COVID-19 is causing a lot of anxiety for our families, especially for those whose children are actively undergoing treatment. Here on March 30th, 2020, I'm trying to answer some of the frequently asked questions. To start off, it is important to keep in mind that this new virus, SARS-CoV-2, is a new disease and that we are still in the process to learn and to better understand the impact this virus has, especially on pediatric brain tumor patients. One of the most important things you as a family can do is to stay informed and to stay in close communication with your care team, as we will learn a lot more over the next few weeks and months to come. Right now, we know that children generally have a much milder course compared to older adults, and often the disease is relatively mild. However, we also know that patients with a suppressed immune system might be at a higher risk to develop more severe symptoms from this new coronavirus, but there's still a lot we need to learn. My general advice is to adhere as best as you can to the current guidelines. Try to isolate as much as possible, avoid contact with others. If you have been in touch with a person who tested positive for the coronavirus, please contact your care team immediately. They will be the best people to judge what the best course of action is. Sometimes you will be advised to come to the hospital to monitor your child very closely. Now I'm going to address some of the specific questions that I was asked. Are children with a brain tumor inherently at high risk with COVID-19, even if surgery was over 6 months ago and they aren't on active treatment? If your child had surgery about half a year ago and has not needed any additional therapies, we assume that the immune system of your child is the same or compares well to the immune system of a child without a brain tumor. So there's no specific reason to believe that these children are at increased risk for a more severe course than contracted with the coronavirus compared to other children without a brain tumor. In this situation, however, it will be critical to discuss with your care team about follow-up visits and follow-up MRIs. Many centers now have moved to conduct some of the more considered routine visits to telemedicine visits to avoid that families have to come to the hospitals. Sometimes follow-up MRIs that are planned can be postponed by a few weeks depending on your child's unique condition. So please be in close contact with your care team to address some of these specific questions. The next question I was asked: what should I do if my child is experiencing symptoms of their brain tumor? They are due to a scan, but that has been cancelled. If your child is experiencing any symptoms of their brain tumor, please contact your care team immediately and discuss the best next steps. Most likely, the team will advise you to come to the hospital for evaluations. Based on the symptoms, there might be other advices that the care team will provide you, but most clinics continue to offer urgent scans if it's deemed necessary to take care of a child with a brain tumor. The next question was: how do you evaluate the risk currently of having treatment versus deferring treatment during the coronavirus and pandemic, especially for neurosurgery that was planned, radiation therapy, but also chemotherapy or other therapies such as targeted therapies or immunotherapy? Obviously, your child is suffering from a serious disease and often treatment cannot be delayed. You should discuss this with your treating team, but generally at this point, we do not recommend to halt treatment if deemed necessary to start immediately to take care of a brain tumor. There are many systems taken into place now at different hospitals or within the hospital setting to make sure that your child will be safe and that it will not contract coronavirus while being hospitalized. but it is important that you continue to receive the treatment that was planned for the brain tumor. So please do not stop any treatment that is currently prescribed to you for your child's brain tumor without discussing this in detail with your treating team. What advice, reassurance can be offered to families if they can't access the treatment they had planned for their child, especially if this treatment was planned to take overseas? We are frequently asked this question if brain tumor patients or families had already planned to go to another country, often abroad, to get additional therapy for their child with a brain tumor. For example, some therapies are only available by participation in a specific clinical trial. Unfortunately, at this time, I don't have any great advice for these families. Many centers, for example, many centers in the US start restricting enrollment into clinical trials, especially if these are early phase trials, even for non-international patients, and that is a very dynamic situation. So it is very important that if you have already made plans to contact the study team locally to discuss any other options you might have participating in this novel therapy that you had planned. It will also be important for you as a family to consider that if you have the opportunity to continue to take part in the care abroad, that you plan that you might be there for a longer period of time than you had initially planned, given more and more travel restrictions that are being put into place. So I think you have to plan very carefully what trial participation or seeking care outside your home country could potentially mean for you and your family. If you're already enrolled in a clinical trial, you might want to discuss with the clinical trial team if there's any possibility to ship the study treatment to your home country and to work with your team locally to continue the therapy, especially if your child is benefiting from the treatment. This is normally not feasible, but under the current pandemic regulations, there might be some options and opportunities to make this possible for you and your child. So this is something you should discuss in great detail with the clinical trial team as well as your local team to see if there are any options that would make it feasible that study drug could be shipped and you could continue the treatment at home. In many instances, this will unfortunately not be feasible, but for some therapies, especially if these are given by mouth, that might be feasible. The other question that is frequently raised, and I think is a very important one, is how to best balance quality of life for your child and for you as a family, but trying to follow the guidance on self-isolation. In my opinion, it is critical that to the best of your ability, you continue to try to self-isolate. This is important for the health of your child, and it is also important to really stay in close contact with your treating team if any symptoms arise. However, whenever possible, we think it is also very important to create a normal, day-to-day living situation for your child as best as possible. There are many websites that outline how you can stay active by still trying to self-isolate. There are many fun activities you can do with your child at home. I also recommend to continue to go outside as much as feasible, given your own country's regulation, but especially also avoiding crowded areas and playgrounds. I also think it is very important for you and for your child to keep up a routine. Children tend to do much better if they have a routine, if they know what they can expect day by day. Make plans with your child and engage them in the planning process. It is critical also, in my opinion, to have open discussions with your child about the current pandemic. They will have their own fears and thoughts, and it will be very important that you address these with your child in open discussions within your family. In general, I think each family will have to find their own way how to best cope with the current situation. but these are some general recommendations we have. Try to stay active as much as you can. Try to develop routines that work for everyone in the household, and try to continue to have a positive attitude. Your child will very much respond to what you show them, and can remain positive as long as you can create a positive environment in these challenging situations. Thank you very much.